Hi, I'm Chitra Nawbatt with General Catalyst, and today we're joined by Chris Altchek, CEO of Cadence. Chris, thank you for joining us.
Thank you for having me, Chitra.
Cadence is a General Catalyst investment and portfolio company in our health assurance network. How does Cadence help achieve health assurance, which is bending the cost curve and making quality care more affordable and accessible?
People managing chronic conditions want accessible, personalized care. Cadence helps large health systems and their physicians deliver that at scale.
Can you give us an example to bring that to life and talk about the impact?
Sure. So managing chronic conditions requires patients' vitals and good data on a daily basis to make sure that they're following the right care plans and getting the right medications. Good example is yesterday we had a patient with a very low heart rate first thing in the morning. Our system knew that at 7 a.m. he takes medications that would further lower his heart rate. We were able to get in touch with the patient, have him delay taking his medications until he could do a telehealth consult with his physician. That's just one example where a patient potential hospitalization was avoided because we have good data that can deliver good care.
What are the areas where your remote patient monitoring devices address?
We're focused on the 4 big chronic conditions: heart failure, hypertension, type 2 diabetes, and COPD. Those conditions unfortunately impact over 55% of adult Americans in the US. They're widely prevalent, and when we look at the clinical care that those people are receiving, largely they're not receiving guideline-directed care. And our goal at Cadence is to close the gap for all Americans.
How are you working with health systems? How are you working with physician offices?
So today, managing chronic conditions is just too difficult and too expensive for large health systems to do at scale properly. And so Cadence comes in and partners with health systems to really become an extension of their practices to do 3 things. First, to make sure the best devices are in patient homes so we can extend care outside the 4 walls of the hospital. Second, we engage patients with our industry-leading software platform that makes it very easy for patients and very easy for clinicians to manage these diseases. Third, we fill in the gaps in care. So we support care management teams in whichever ways they need support to make sure that these programs can be deployed to tens of thousands and hundreds of thousands of patients concurrently.
Talk about what happens when the results are generated in terms of the monitoring of that data, that activity, the real-time connectivity to the doctor, and then in the health record.
Yeah, so these patients are frequent utilizers of healthcare services. These are the patients that are largely today accounting for the vast majority of healthcare spend in the US. They're in and out of hospitals, and largely longitudinal care has been very hard to deliver at scale. So a good example with Cadence is last week we had a patient whose blood pressure was accelerating. It was 180 over 110. We had them take a second reading. It was even higher. Off of that second reading, it generated an alert for a clinician to get in touch with that patient within 15 minutes. In this case, the clinician that was available was in the Cadence remote hospital team that could get in touch with the patient. The patient was at risk for tissue damage, which largely happens when blood pressure is high and accelerating. And we were able to coordinate for the patient to be transitioned to be seen in person at the local hospital. When the patient arrived at the hospital, the clinicians there were ready to admit, knew what was happening with the patient, and were able to deal with the situation in a quick turnaround. Without Cadence, these patients are largely on their own, making decisions without good data, and the clinicians don't have the connectivity to manage these patients properly.
How are you helping systems from the shift with fee-for-service to value-based care?
The fundamental shift from fee-for-service to value-based care will largely take place over the next 5 to 10 years. So it's a process, it's not an on-off switch. Today we work with one of the largest rural hospital systems in the US, LifePoint, across 88 hospitals across 35 states. And the important part about remote monitoring is that it works in both fee-for-service and value-based care arrangements for patients, largely because the ROI on these programs has been demonstrated. And so there's real flexibility to work in both models. In the fee-for-service model, it makes a lot of sense for ambulatory care settings for patients who need this. And then in the value-based care setting, obviously we want to move as much care outside the 4 walls of the hospital into the home. And we want to be delivering as much personalized and preventative care as possible while engaging patients in their own care plans. And Cadence delivers on all those metrics been very exciting to see the model work across the spectrum and really help patients assure better care.
Doctors, health systems tell me, Chitra, we don't need just another commoditized transactional, random, remote patient monitoring device. What do you say to that?
Look, our big push to our partners is we're a partner, not a vendor. We're aligned in every way. We're aligned clinically to patient outcomes. We're aligned financially to the health system success. And ultimately, we're aligned from an experience standpoint where if we're not delivering the best experience for clinicians and the best experience for patients, then people don't need to keep working with us. And so far, we've seen really high retention on the patient side, very high clinician satisfaction, and very positive outcomes clinically.
Chris, thank you so much for joining us.
Thank you for having me, Chitra.